Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everybody. Happy Friday. Happy Halloween. It is 9 o'clock on Friday on October 31st, 2025. And you are joining me, Deb Burton, host of Friday Friends, where every week I bring you information that you or someone you know needs to know about. So please make sure you hit the like button, the share button, the bells, the whistles, all those social media cues that say, hey, check this out. Because we are having a great conversation this morning with a national organization that is going to share with you some of the changes that are anticipated with HR1, formerly known as the Big Beautiful Bill. So this is things that may impact yourself, but will definitely impact someone that you know. So help us get the word out by sharing this across your community. Now, as you know, RI Elder Info is a 501c3 nonprofit, and we could not do this without the support of our sponsors. So a big thank you to Point 32 Health Foundation, United Healthcare, and McCarthy Law. Here's a message from McCarthy Law.
Here at McCarthy Law, we practice in the areas of estate planning, long-term care planning, elder care law, and residential real estate. Our focus is really on providing peace of mind to our clients.
If you're interested in scheduling a consultation with our office, you can feel free to reach out to us at 401-541-5540. You can also reach out via website at www.mccarthylawri.com. You also should check out our social media, both on Facebook, Instagram, and LinkedIn for some helpful tips and tricks.
Welcome, Hannah Diamond. How are you?
Oh, Deb, I'm good. Thank you so much for having me this morning. And hi, everyone on Friday Friends. It's so nice to be here with you.
Absolutely. So please, can you share with everybody the organization that you're with and what it does?
Sure. I work for an organization called Justice and Aging. We've been around for about 50 years. Our efforts primarily focus on advocating for those who have been historically excluded from justice, such as LGBTQ individuals, low-income women, people of color, people with limited English proficiency. And we use the power of law to do that. And we're trying to secure access to public benefits like healthcare, like affordable housing, economic security, and the courts for very low-income older adults.
And that's something that I had subscribed to some of your newsletters and things like that. And I find it to be such a tremendous resource to get accurate, up-to-date information. So I really appreciate what you're doing as someone who shares information with folks regularly. It's awesome what you're doing.
Thank you so much. Yes, if you're not already a member of our Justice and Aging family, I really encourage you to go to our website and sign up for our listserv. We produce countless resources. They're all free. So it's things like webinars, issue briefs, fact sheets, alerts regarding things that are happening at the federal and sometimes even the state level. So really encourage your audience to Google us and sign up for our materials.
Yes, and it was one of your webinars that I was listening to regarding HR1, formerly known as the Big Beautiful Bill, that really kind of shared what are the anticipated impacts for our older adult community. So I was wondering if you might be able to share that briefly today.
Sure, I'm happy to. Maybe I could start before I even zoom in on older adults and people with disabilities. I could do the 1,000-foot view just to tell your audience how it came about. And okay, so it came about via something called the reconciliation process, which is a fast track tool that Congress uses specifically to pass a law. It's not subject to something called the filibuster in the Senate, and it doesn't require a 2/3 vote. It only requires a majority vote. So basically, I say that to say this bill became law very, very quickly. And as a result, the general public often doesn't know what's in the law now. So I really appreciate you having me on today to talk about it. So it was passed by only Republican votes on July 3rd, and it was signed into law by the president on July 4th. It was formerly known as the One Big Beautiful Bill, but actually that name was stripped at the very, very end. So I'm going to refer to it as HR1 in this conversation. At a very, very high level, the law takes from the least and redistributes to those with the most by making the largest cuts to Medicaid and SNAP in the collective program's history. So just to give you some idea, those who are of the lowest income are going to see their incomes decrease by about $1,200 a year, while those with the highest incomes, so top 10% of household incomes, we're going to see their incomes increase by over $13,000 a year as a result of HR1.
When you say, do you mean cost will increase?
So there are various components in the bill, which are now law, which we'll talk about. So there's cuts to public benefits. So we're going to see losses there. There's a Social Security deduction that some folks can take. So I'm happy to go over the way in which that's going to happen. But basically, it's really taking the resources from those with the least and redistributing it to those with the highest incomes, all while increasing the deficit by $3.4 trillion.
Okay. Yeah. Tell us what all of that means in our day-to-day life.
Okay, sure. So I'm going to specifically talk about the provisions within the law at a very high level that impact older adults and people with disabilities. There are also additional components of the law that do not impact directly older adults and people with disabilities, but we anticipate negative consequences, even though certain populations are carved out. So I'll go over both. As I mentioned, the law makes the biggest cuts to Medicaid and SNAP in the collective program's history. So almost $990 billion worth of cuts to Medicaid and about $187 billion worth of cuts to SNAP. That's the Supplemental Nutritional Assistance Program. As a result of those cuts, we're going to see about 15 million people likely lose health insurance, and we're going to see about 4 million people lose SNAP coverage.
And just for clarity, are individuals who are in this country undocumented, or as some will refer, illegally, are those individuals presently receiving SNAP benefits?
So I will say no. That is a misconception. The individuals that are receiving public benefits now are those who are lawfully present. Those who are undocumented really do not have access to public benefits. This law, which I will talk about, limits the scope in terms of eligibility for Medicare, Medicaid, and then ACA marketplace subsidies for certain lawfully present immigrants. So it makes those who have paid taxes, who are here legally, who are contributing to our society, it makes them ineligible for health insurance coverage, which likely will result in them being sicker and result in an overall sicker population because they're not going to be able to access insurance.
Wow. Okay. A lot's happening.
A lot's happening. I will say I found in previous conversations when I've talked about the law, it can be very overwhelming. These are populations that we care about. These are our loved ones, right? And the law does have many harmful components. I would say, and I defer to you, Deb, but there's a lot that we can be doing. As recipients of care, as advocates, there are strategies that we can do to mitigate harms. So I'm happy to talk about that as well. But I think that it's really important that we know what's in the law and what's not in the law so that we have the correct information so that we can empower our community and help to ensure that as many people can still access services as they can.
Yeah, absolutely. Because I think sometimes we hear it as a collective thing, and there's a lot of rhetoric about who is eligible, who's not eligible, kind of fault and things like that, where, you know, the reality is folks need to be prepared for what the changes are that are coming.
Right.
So if you can share that, that would be great.
Sure. So additional changes that impact older adults and people with disabilities. There are some changes to long-term care quality and access contained in the law. Specifically, there was a rule called the Nursing Facility Staffing Rule that was aimed at improving quality of care in nursing facilities by implementing staffing requirements or ratios. So a ratio of direct care workers to residents, and also having a nurse on site for 24 hours a day as opposed to 8 hours a day. There is a moratorium on that law now, so a pause on that law for a 10-year period. So that will not be implemented. So we're likely going to see, I would argue, a decrease in quality, but there are not going to be those efforts to increase quality in nursing facilities. And that law was estimated, if it had been implemented, to save 13,000 lives per year.
And that's where we look at whether or not a nursing home is considered working short. You need to have a definition of not working short in order to define working short. And if there is no minimum, you possibly could have one nurse's assistant for 30 residents, and that's not, in theory, a problem under the law right now, right?
Right. So exactly that. It was trying to make sure that there was a ratio in place. I think, I don't want to misspeak, but I think it was 4.1 was the ratio contained within the rule, just to ensure that residents could get access to the quality of care that they needed. Additionally, there is a change regarding eligibility for long-term care access. Right now, when an older adult or a person with disabilities applies for long-term care benefits, they are subject to very strict income and asset thresholds. We often see asset thresholds at the state level, unless the state has made a change in their law. We're seeing resource thresholds of about $2,000. So oftentimes individuals have to impoverish themselves in order to access Medicaid benefits.
Yeah, Rhode Island is a little different in that we do allow people $4,000 in liquid assets, cash checking, cash value of your life insurance policy. But I hear what you're saying. Most states, it is around the $2,000 mark. And I don't think people really realize how low that amount is.
And I would argue that still $4,000 is very limited. The cost of maintaining an individual's home, the cost of life, is just expensive, right? And so $4,000 comes and goes very quickly, especially when you're living in the community. The home that individual lives in is excluded when they apply for benefits. So an equity value of the home up to a certain amount is excluded. This law reduces that equity threshold and doesn't allow it to be adjusted for inflation. What does that mean? That's a lot of wonky terms that I'm throwing at you. Basically means that the law could potentially make it more difficult for individuals to access home and community-based services, because it's possible, if the home is worth over a certain equity threshold, that they would be forced to sell their home and spend down funds in order to access Medicaid benefits. And the reason that I'm talking about Medicaid, and Medicaid is so important for older adults and people with disabilities, is Medicaid covers critical services that Medicare does not. Medicaid is the primary payer of long-term care services, and specifically home and community-based services, those services that support individuals to age in their homes. These are things like personal care services, Meals on Wheels, transportation. So these are really, really critical benefits. And we want to ensure that people can still access them, and they can. It's just I will say a big caveat here. We don't really know what this is going to look like. I'm showing you anticipated impacts of the law because these provisions have not been implemented. But it's important that we know about them, and that individuals, especially if they're eligible now for coverage, that they're accessing the coverage that they are eligible for.
Absolutely. It's important. Yes.
Other things that I would talk about at a high level that are impacting older adults and people with disabilities. The law allows a modest tax deduction that is overwhelmingly going to go to higher income older adults, but it changes the Social Security insolvency date for all recipients. So it's actually going to move up the insolvency date by 1 year as a result of this change. So Social Security is going to become insolvent in the year 2032 as opposed to 33. So that's a big change to be aware of. Along similar lines, there are repercussions for Medicare. Because the law increases the deficit by $3.4 trillion, it triggers something known as pay-go, which basically means that unless Congress acts, the Medicare program could be subject to $500 billion worth of cuts. Now, in the past, Congress has acted to prevent pay-go from happening when there has been an increase in the deficit. But we're kind of in unprecedented times when it comes to Congress and the two parties working together. So this is something to make sure that our lawmakers are aware of and that they're actively working on to prevent those really significant cuts to Medicare as a result of this law.
Okay, I just want to back up because those are two big things, and like I feel like the record in my head just scratched.
Okay.
So for Social Security, HR1 has enabled some of our higher earning Social Security recipients to have a bigger tax deduction, but in doing that, it has actually accelerated how quickly the Social Security trust fund that we all pay into is in jeopardy of running out of money if some changes aren't made. And then because that's happening, it triggers something that can impact Medicare. I'm not sure I followed that entirely.
So the first part is completely right. Because of this deduction, because of the cost of the deduction, it impacts the Social Security Trust Fund overall. And so the funds are going to run out 1 year sooner. So that's one bucket. Then separately is the Medicare sequestration concern. Basically, whenever there is an increase to the deficit like this, it triggers something statutorily known as pay-go. Pay-go is an acronym.
Okay.
And pay-go will go into effect unless Congress acts. And so the result of pay-go could be $500 billion worth of cuts to Medicare. Medicare, as a reminder, is a federal health insurance program that is available to people that turn 65, also certain individuals with qualifying disability benefits through Social Security. And so eligibility in large part is based upon work history. So this is something that is a beloved, both Medicare and Medicaid are beloved health insurance programs, also Social Security, beloved programs. And this law impacts all of them.
Got it. And that was one of the things that I have like struggled to wrap my head around. So it has to do, the Medicare changes have to do with the nation's debt ratio.
Right. It's triggered by the deficit, by an increase in the deficit. Exactly. And I will reiterate that every time this has happened in the past, Congress has acted to prevent cuts to Medicare, but they still need to act in 2026 to prevent those cuts.
And when you say act in 2026, do you mean like the calendar year, like, a couple months from now, like between January 1, 26 and 12/31/26? Or do you mean like the federal fiscal year? Because that runs like right now, 10/1/25 to 9/30/2026. So when we talk about 2026, it sounds weird, but when is 2026?
Sure. I'm actually going to take the question in a little bit of a different route. I'm going to answer it at a higher level that many components of this law have different implementation timelines. And actually I've shared a link to our Medicaid defense resources, and those contain the implementation timelines for various components of the law. There are implementation timelines in terms of parts of the law that are already underway to be implemented. So states already have to do them, all the way up to 2028. I will say that the biggest challenge in terms of holding lawmakers accountable regarding this law is that the majority of the provisions within the law, especially those that are most harmful, they go into effect after the midterms. So many individuals will not feel the effects of this law until after they have already voted. And so it's something to keep in mind again with the education. It's important for you to be spreading the word. You, in terms of your audience, I'm considering you all advocates here. we need to be educating our communities about what's in this law so that it can inform them in terms of how they vote in the upcoming midterms next year.
Got it. And so right now, the way everything is kind of mapped out on the timeline, it's right after November voting next year, not the voting that's coming up in the next couple of weeks, but actually November of 2026.
Right.
That's when things start to become implemented. So it's important that everybody understands so that they can make informed choices when they vote.
Exactly. And there are components that are already in effect. There are components that go into effect before the midterms, but the majority of the most administratively burdensome or potentially harmful components of the law all go into effect after the November elections next year.
Got it.
Another high level category that I could talk about in terms of the impact of the law, it's cutting eligibility for certain lawfully present immigrants. So it's specifically cutting Medicaid eligibility, Medicare eligibility, and then eligibility for marketplace subsidies. So again, as I mentioned and alluded to earlier, this population is likely to become uninsured. And then the other thing at a very high level that's going to impact the populations that we're talking about is that the law failed to extend the enhanced premium tax credits for marketplace coverage. These were COVID-specific enhancements. And this is actually what Congress is arguing about now via the budget, whether or not they are going to continue these. But the law did not continue that funding. And as a result, we think about 4 million people are likely to lose coverage due to the increased costs that are associated with lack of those enhancements.
And that's the open enrollment that starts tomorrow, November 1st. So that's where folks can log in and start seeing the different insurance plans and the changes in premiums without those tax credits, right?
Right, exactly. And you're going to see a significant premium increase. Yes.
Okay. And I wanted to go back and just clarify. You had mentioned, I forget if you said lawfully present residents or lawfully permanent residents. Is there a difference in those? And are they called something else? Because I don't hear that term used very often. So who is that?
So let me give you the eligibility categories that are listed in the law. So basically, it eliminates coverage for Medicaid, Medicare, and those marketplace subsidies for refugees, asylees, and other lawfully present immigrants. And specifically, those who are eligible are restricted to the following categories. They're lawfully permanent residents, they're Cuban and Haitian entrants, and then they're compact of free association migrants, or lawfully residing children and pregnant people. Basically, these are categories that are capturing green card holders.
Okay. Yep. Formerly known or also known as green card holders. So the green card holders are going to be at risk of losing their health insurance?
No.
They're the ones who can keep it.
They're going to be able to keep it. It's just limiting the scope of the populations that are eligible. The populations that are not going to be eligible, for example, are those refugees or asylees. So there's a narrowing of a scope in terms of coverage and access.
Okay. So if you were, say, I'll completely make it up, but say, for instance, you were an interpreter in Afghanistan, aiding our military, you come here as a refugee or asylee, but you don't get your green card, you could be impacted by these changes.
Yes.
Got it.
So really limiting who has access to health insurance coverage. And many of these individuals, they're contributing to our society, they're here legally, they've paid taxes, right? And so unfortunately, they're not going to be able to access critical coverage that they've paid into. That's a real devastating part of it. Another thing in terms of high level that I would just love your audience to be aware of, There are specific services that are particularly vulnerable as a result of these funding cuts. Basically, states have to balance their budgets, unlike the federal government. They have to balance their budgets. There are certain services specific to Medicaid that are mandatory, that states have to provide, like nursing facility services. Home and community-based services, those optional services through Medicaid, or vision services, or dental services, or hearing services, none of these are mandatory, believe it or not. That surprises a lot of folks. These are all optional Medicaid benefits. And as a result, we are very concerned that in the face of a budget shortfall, because states are going to have less money as a result of these federal cuts and as a result of restrictions contained in the law in terms of how they can raise money. So as a result of them having to balance their budget, they're going to be forced to make very difficult decisions. And so we are concerned that optional benefits, so home and community-based services being the primary one that we're concerned about specific to older adults and people with disabilities, in large part because it's such a significant cost, and also because so many older adults and people with disabilities use home and community-based services, we're concerned about cuts there. And we have the research to support that concern. In the face of a budget shortfall between 2007 and 2009 as a result of the Great Recession, we saw every state cut one or more of its home and community-based services programs. So in terms of advocacy, we really need to be working together to ensure that home and community-based services does not receive a funding cut, that it's not on the chopping block, and that additional expansions that states might have engaged in, like, for example, we talked about the asset thresholds. Sounds like Rhode Island offers a more generous asset threshold than other states. That would be something that needs to be protected, right? So it doesn't go down to the federal minimums. Additionally, provider reimbursement rates. Providers are already operating on very, very thin, very narrow margins. And so we are concerned again that if providers were going to have a reduction in terms of that rate, that we could see, for example, an increase in the direct workforce shortage or crisis, because providers are going to have less funds to invest in their workforce, which could hinder access to home and community-based services, for example. So there's nothing within the law that requires states to make those cuts, but we are very concerned about them, given the fact that the items that I just listed are not mandatory.
And so that's where there's an opportunity that individuals here in Rhode Island, any place watching, individuals can reach out to their elected officials to say, wait a minute, home and community-based services help me, help my friends, help, my papa and my nana, be able to stay home and stay out of long-term care, nursing homes or assisted living, having that CNA come to the house, just from a financial standpoint, that yes, it might be expensive because many people are receiving home and community-based services, but in comparison to a long-term care setting,
right,
there's cost value savings in protecting that program. So folks can reach out to their elected officials to say, when you're looking at the budget, we need to save this. Is that what I'm hearing as far as advocacy?
Yes, exactly. I think that the primary rationale behind home and community-based services, it's where people want to be. It's the preference of individuals is to age in their community, age in their homes. And also it produces savings. Home care is less expensive than care in an institution, in a nursing facility. So especially in the face of a budget shortfall, we don't want to be cutting services that save the state money. I would add, in terms of a strategy, so we want to be learning what's in the law and what's not in the law. We want to be educating our friends in our community and educating policymakers, right? So that's your lawmakers. That's a great point that you just said, Deb. We want to be working with other partners. We want to be forming coalitions. We want to be collaborating with our neighbors. We want to be sharing resources and uplifting shared messaging to make sure that our voices are loud and that we're heard. And then we really want to be sharing stories. So for your listeners, you all as Medicaid recipients, as SNAP recipients, as having a loved one in your community, your neighbor is on these programs, talking to people in positions of power about the importance of Medicaid benefits is critical so that we can reduce harm at the state level and ideally work to repeal the harms of this law at the federal level. So really the stories, I cannot emphasize enough when I've talked to lawmakers in the past, and even in this conversation, when I throw out a number like $1 trillion, 15 million people, what does that really mean? Those numbers are so large, it's hard to grasp and comprehend. But when you have a story that actually illustrates the impact and the importance of these benefits, that's what sways lawmakers. So in terms of your audience, sharing your story with lawmakers is a really, really important act that you can be doing now and as we move further into the implementation of this law.
This has been so helpful, Hannah. I've kept you more than twice what I had asked you to come on the show for, and I feel like there's just so much to wrap our heads around.
Yes.
Would you maybe be available to come back on the show maybe after the first of the year when some of these things have kind of landed?
I'm happy to come back. There's a lot more within the law. Actually, we didn't get a chance to even touch on
we can keep going. If you have time, we can keep going because
I'm happy
my God.
Yeah, just briefly, I just want to tell your audience about 3 big things that we didn't get a chance to talk about.
Oh yeah, no, please. I just want to be respectful of your time.
Oh, thank you. But I'm happy to come back, Deb. I'll talk to your audience anytime. Hang out with you on Fridays. It's great. Join you all for a cup of coffee in your homes.
Perfect. But yes, please share.
Okay, so I'm sure if you've heard of HR1, you have heard that there are various provisions that impact and really try to reduce enrollment in something called the Medicaid expansion population. The Medicaid expansion population are folks ages 19 to 64 with incomes up to 138% of the federal poverty line. Now, most older adults and people with disabilities are going to be in a different Medicaid eligibility category, but there are still folks who are identified between the ages of 50 and 64, or those who are waiting on a formal disability diagnosis from Social Security, or caregivers of older adults and people with disabilities who are engaged in and enrolled in Medicaid expansion. And so I want your audience just to be aware of some big things that are impacting that population that will likely really reduce enrollment and potentially hurt or negatively impact them.
So I'm really interested in this because we've been looking at some data, and in that expansion population, 55 to 64 is the largest population enrolled here in Rhode Island.
Okay.
So whatever you're about to say, it's the 55 to 64-year-old population that these changes are really going to impact. So I am riveted.
Okay. Well, a few things I want to share with you. One, this population is going to be subject to an additional eligibility verification, So right now, when an individual is enrolled in Medicaid, the state is required to verify that they are eligible at least annually, so once a year. This law changes that and requires that states have to verify eligibility at least twice a year, so every 6 months. And so the challenge here is that that's very administratively burdensome for the state to implement. It's a lot of resources on them. And it's also difficult for individuals to comply with. We saw during the public health unwinding process, so during COVID, when eligibility or verifications were paused for a while and when they resumed, we saw data that showed that 70% of people who were eligible lost coverage, not because they had a change in their finances, not because they were no longer eligible for benefits, but because they couldn't comply with the paperwork, for example. And so this is a big concern and could potentially result in many, many people losing coverage. Another big part of this, and probably the most talked about component of the law, they're called work requirements or community engagement requirements. So the law will require the Medicaid expansion population. So that population, again, ages 19 to 64. So you mentioned the 55 to 64 population. These individuals, these folks are going to be subject to this. They have to have 80 qualifying hours of work, volunteer, or school per month. Now, we have seen from various states that have had work requirements in the past, like Georgia, we've seen that work requirements don't actually encourage folks to work. The fact is that the majority of folks who can work are working in the Medicaid expansion population. And if they are not, they would likely qualify for an exemption if they were accessible. An exemption like a disability, or there are definitions in the law, things known as medically frail. We're waiting to see how that's going to be defined, or caregiver. The problem is that the exemptions right now are pretty narrow. And again, they require burdensome paperwork. And what we've seen from other states is because it's been so difficult for folks to qualify for an exemption because of those paperwork requirements, folks lose coverage when they should be eligible. So we're very concerned about that.
Got it. So if that's like, if one of the allowed exemptions is, say, caregiving, then every 6 months you're going to have to produce some kind of proof that you remain a caregiver.
We're going to have to see how it's defined at the federal level.
Got it.
So we're waiting on guidance. There's going to be guidance that has to come out by June of next year. CMS, the Centers for Medicare and Medicaid Services, which has jurisdiction over the Medicaid program, we've heard rumblings that they might produce some kind of instructions for states by the end of this year.
Okay, hold on a second.
Yep.
The federal government does not have to issue any particular guidance or direction until the end of June, but this goes into effect right after Thanksgiving next year?
No. So
I'm like, oh gosh, put on our truck shoes.
Yeah. Well, for the implementation timeline for work requirements specifically, let me find that just to remind myself. The work requirements go into effect in 2027 unless the state has applied for an extension, and the longest extension there is 2028. That said, Deb, your concern is very valid because states are not ready to implement work requirements. There's research that shows us that states' processes in terms of their data processing, in terms of how different departments communicate with one another, in terms of all the education that they're going to need to do to ensure that folks know about this, to ensure that folks who are not subject to these requirements are protected. All of those things require significant system updating. And so not only is this timeline fast, but also given the fact that CMS is not required to put out guidance until June of next year to help us define some of these definitions and really get into the implementation of this particular provision, especially when it's so labor intensive to do, it's very concerning. I will say that as an advocate, I've been working with New Jersey advocates, for example, who are working with their Medicaid agency to help inform what that implementation looks like proactively. So encouraging them to make decisions that will really reduce coverage loss within those federal restrictions and parameters that are contained within the law. So there are things that we as advocates can be and should be doing now to reduce coverage loss. And so that's why like working in a coalition is really important because not everyone needs to know the kind of wonky technical Medicaid policy, right? But you can amplify the messages that are contained from those recommendations. So flagging it high level for this particular section, the Medicaid expansion implications of the law are very significant. We're anticipating a lot of loss of coverage from the two things that I just mentioned. And we want to be working with our state to reduce harm.
Wow. Okay. We got a lot going on.
A lot. And there are other things too, but let's not go any deeper. Your listeners have a lot to chew on, and I'm happy to come back.
You know what? And that's the beauty of this, being out there is people can rewind and be like, wait a minute, what?
Yeah. Right. And also,
right. There's a lot of wonky language, and it comes out in the news, and I think it makes it harder for people to understand what is PAYGO and why does that matter, and how is this impacting me right now today when I'm trying to figure out my grocery list for next week, and how am I gonna cover my health insurance come January 1, and going too far into the weeds can sometimes lose people. So I am very grateful to have this conversation with you, because some of the stuff I'm like, what? This is so helpful to me.
Good. I'm really glad. And I encourage your listeners again to go to our Medicaid defense resources on justiceandaging.org. And there you can find webinars where we talk about this material for an hour, right? And you can pause that. You can pause that webinar and re-listen to it. You'll find fact sheets that go through each provision of the law and talk about its impact on older adults and people with disabilities. And then you're going to find timelines regarding all the implementation dates that we talked about today, so that you'll know what's happening when. So again, I want to encourage folks that they have resources that are available to them. And so please utilize them. And again, thank you so much, Deb, for highlighting this important issue.
Yep. And I just want to clarify, is Justice in Aging a nonprofit, and are you receiving funds from one side or the other to promote one thing or the other, or you're just providing information and resources?
We are a nonprofit. We are nonpartisan, and our priority is preserving access to benefits for low-income older adults. That's who we work for, right? And our materials are or our audience is really advocates who work alongside direct recipients of these services. So the majority of our materials are aimed at legal aid staff, area agency on aging staff, SHIP counselors. So those are individuals that help with unbiased Medicare counseling. So we are nonpartisan. Again, we're following how we define justice, which is preserving access to critical benefits and care.
Absolutely. Hannah, thank you so much. Now I've taken you way over, and this has been wonderful. I'm so grateful. And I still hope you'll come back in after the first of the year, because I feel like there's just going to be a whole lot more coming, and we're drinking from a fire hose.
Happy to come back. Thank you again so much for having me, Deb.
Thank you. Everybody, there is a lot of changes coming. The more we know, the more informed we can be when we are making decisions for ourselves and for our family members. So we're going to continue to bring you information and updates that I hope you are finding helpful and easy to understand, because it kind of feels like, even for me, a lot to wrap my head around all at once. I am glad. I think this is one of my longest Friday Friends in a really long time. But there's so much happening that we all really need to be aware of in real life conversations. So if you would, please share this out among all of your friends, family members, to get this information out so folks can be informed about the changes that are coming and how they may impact you, your family, and the community at large. I am so grateful that you have stayed on with me for almost 45 minutes to get this information. I look forward to seeing you all again next week, where we start our Friday Friends specials of resources for veterans. In the meantime, be well and be kind.